Dr. Shweta Chakrabarti. Doctor, thank you for being here. I want you to pick up on what the president just said, calling this a hoax. Is this a hoax?
This is not a hoax. This is something the scientific community is aware of, is on top of, and is saying at the highest echelons of governance globally, which is the World Health Organization, that we need to take it very seriously. It's a high risk, it's a high priority for global public health, and to prevent it from truly turning into a cross-border pandemic, we need to be prepared, we need to be proactive, and country by country, we need to get prepared for this virus to show up. It is increasing in number, and what we're finding is that those primary healthcare systems that haven't dealt with this type of infection and spread in the past are more at risk than others. The U.S. is lucky in that sense. We're better prepared. There's countries in Africa that might not have that same sort of public health system infrastructure in place. So it's critical we don't just look at this from the politics of the U.S., but really as a global public health threat.
So, Doctor, when it comes to us having our first cases now where we don't know the source and the person infected does not have any indication of coming in contact with anybody who had been overseas, what does that tell us about how this is spreading?
What's really fascinating about the origins of this virus is that perhaps that indicates it might have already been with us. So what we saw as what we called initially as the outbreak in China might have only just been this particular year's outbreak. But because we're seeing community spread in other parts of the world with no indication of any relationship to the outbreak in China, that suggests that this virus might have always been there, and now we are diagnosing it as coronavirus. That's worrisome, but it's also, once we identify exactly where this came from, which animal's source, most likely a bat, we'll get a better grip on it going forward in the future. We're already doing a fairly good job in terms of telling people what they need to do to protect themselves. When we have more information about the source, we will have an even better narrative to be able to then secure public health going forward.
The key is trying to figure out the source. I'm curious your thought on this, because China today, overnight, announcing that they have 7 new cases. This is a country of 1.3 billion population. Can that be trusted?
We need to hear what Chinese government is putting out there and then trust the World Health Organization's experts that were allowed into the country, allowed on the ground, and doing the work that is critical now, because this is not just a unique China problem. Obviously, this is something we're seeing all over the world. I believe that China has learned from the epidemic that was SARS, and we need to be able to recognize that this isn't going to be something that can be contained. What is really the point or the purpose of not sharing information? This is a global threat at this point. I do believe that the spread primary transmission from the numbers that we're seeing is reducing. It's a secondary and tertiary transmission that's increasing, which is why it's not surprising at all that we're seeing this virus move across borders. It's a microorganism, it's easy to transfer, and it's easy to leak despite all of the containment measures in place. But primary transmission is decreasing, which is hopeful for us in terms of being able to get a grip on this virus.
Talking about the spread of it, Doctor, really quickly here, is there any final confirmation on whether or not this could be spread through the air? First, the health organization in China had said that they found out that it was, and then they backtracked on that and said it was not. Can you give us the final word on that?
There's no evidence right now that this is beyond respiratory droplets. And so if it is as contagious as SARS was, which was spread through the air, that is much more worrisome, and we are seeing an increased transmission rate. But at this point, the evidence shows that this is still from sneezing, from coughing, within close proximity to somebody who is exhibiting symptoms.
Okay.
Doctor, thank you. Appreciate your time.
Thank you.
All right, let's turn now to the race for the White House. Today's South